Herpes simplex virus, or HSV, is a common virus that affects millions of people worldwide. It can cause sores on your mouth, known as cold sores, or on your genitals, which can be quite painful and distressing. There are two main types of HSV, each with its own characteristics and common areas of infection. They are HSV1, which typically affects the mouth, and HSV2, which usually affects the genital area. Most people get HSV1 as children, often through non-sexual contact. They get it from contact with saliva, such as sharing utensils, drinks, or even a kiss from a family member. Once you have HSV, it stays in your body for life, hiding in nerve cells and waiting for an opportunity to reactivate. It can be dormant for a long time, meaning you might not have any symptoms for months or even years. However, stress, illness, or a weakened immune system can trigger outbreaks, causing the virus to become active again. During an outbreak, you may have sores that are not only unsightly but also uncomfortable and painful. The sores can be painful and can make everyday activities difficult. HSV is highly contagious. It can spread through skin-to-skin contact, even when sores are not visible. It can also spread through saliva, making it easy to transmit through kissing or sharing drinks. Unfortunately, there is no cure for HSV, but there are ways to manage the symptoms and reduce the frequency of outbreaks. There are antiviral medications available that can help manage symptoms and shorten the duration of outbreaks. These medications can help shorten outbreaks and make them less severe. They can also reduce the risk of transmission to others, which is especially important for intimate partners. It's important to talk to your doctor if you think you have HSV or if you have been diagnosed with it. They can help you understand HSV, how to manage it, and how to reduce the risk of spreading it to others. HSV1 and HSV2 are two types of herpes simplex virus. They are both common and contagious. HSV1 usually causes oral herpes. This is also known as cold sores or fever blisters. HSV2 usually causes genital herpes. However, both types can infect either area. This depends on the type of contact. HSV1 spreads through saliva. This can happen through kissing or sharing utensils. HSV2 spreads through sexual contact. Both types can be spread even when there are no symptoms. This is because the virus can be shed even without sores. Herpes simplex virus is highly contagious. It spreads through direct contact with an infected person. HSV1, which causes oral herpes, spreads mainly through saliva. This can happen through kissing, sharing utensils, or even sharing lip balm. HSV2, primarily responsible for genital herpes, spreads through sexual contact. This includes vaginal, anal, and oral sex. Importantly, you can contract HSV2 even from someone who doesn't have visible sores. This is because the virus can shed from the skin even when symptoms are absent. It's crucial to remember that herpes can only be spread through direct contact with infected skin or mucous membranes. It cannot be transmitted through inanimate objects like toilet seats, towels, or swimming pools. Herpes symptoms vary greatly from person to person. It's important to understand that the experience of herpes can be quite different for each individual. Some people experience no symptoms at all, while others have mild or severe outbreaks. This variability can make it challenging to identify and diagnose herpes without medical consultation. The first outbreak is usually the most severe and can occur within a few days to a few weeks after infection. This initial outbreak can be particularly distressing and may require medical attention to manage symptoms effectively. Common symptoms of oral herpes include tingling, itching, or burning around the mouth. These sensations often serve as early warning signs before visible symptoms appear, followed by the appearance of small, fluid-filled blisters, also known as cold sores, on the lips, gums, or inside of the mouth. These blisters can be painful and may cause significant discomfort. These blisters can break open, ooze, and crust over before healing. The healing process can take several days to a couple of weeks, depending on the severity of the outbreak. Genital herpes symptoms are similar but occur in the genital area. It's crucial to seek medical advice if you suspect you have genital herpes to receive appropriate treatment and care. You may experience pain, itching, or tingling before blisters appear on the genitals, buttocks, or inner thighs. These symptoms can be quite uncomfortable and may interfere with daily activities. Other symptoms can include flu-like symptoms such as fever, headache, and muscle aches. These systemic symptoms can make you feel generally unwell and may accompany both oral and genital herpes outbreaks. Section 5. Diagnosis: unmasking the virus. In this section, we will delve into the crucial steps involved in diagnosing herpes, a common yet often misunderstood virus. Diagnosing herpes typically involves a combination of physical examination and laboratory testing. These steps are essential to ensure an accurate diagnosis and appropriate treatment plan. Your doctor will start by asking about your medical history and symptoms. This initial conversation helps the healthcare provider understand your condition better and identify any potential risk factors. They will then examine any sores or blisters present. A thorough physical examination is crucial to identify the characteristic signs of herpes. To confirm the diagnosis, your doctor may take a swab from a sore or blister and send it to a laboratory for testing. This swab test is a reliable method to detect the presence of the herpes virus. This test can identify the presence of the herpes virus and determine whether it's HSV1 or HSV2. Knowing the specific type of virus can help tailor the treatment plan. In some cases, your doctor may also recommend a blood test. This is particularly useful if there are no visible sores or blisters. This can detect herpes antibodies in your blood, indicating past exposure to the virus. Blood tests can provide additional information about your immune response to the virus. Early diagnosis and treatment can help manage symptoms and reduce the risk of complications. Timely medical intervention is key to improving quality of life and preventing the spread of the virus to others. Section 6. Treatment options, keeping herpes in check. While there's no cure for herpes, antiviral medications can help manage the virus and reduce the severity and duration of outbreaks. These medications work by interfering with the virus's ability to replicate. Commonly prescribed antiviral drugs for herpes include acyclovir, valacyclovir, and famciclovir. These medications can be taken orally or, in some cases, intravenously. Your doctor will determine the best treatment plan for you based on the severity of your symptoms, frequency of outbreaks, and overall health. Early treatment is crucial for optimal results. Section 7. Prevention strategies. Shielding yourself from herpes. Preventing herpes involves adopting healthy habits and taking precautions to minimize the risk of transmission. If you have oral herpes, avoid sharing utensils, lip balm, or anything else that comes into contact with your mouth. For genital herpes, abstaining from sexual activity is the most effective way to prevent transmission. If you are sexually active, using condoms consistently and correctly can significantly reduce the risk. It's also essential to communicate openly with your partner about your herpes status. This allows for informed decisions about sexual health and reduces the stigma associated with the virus. Section 8. Living with herpes, long-term outlook and complications. For most people, herpes is a manageable condition with no serious long-term health consequences. However, in rare cases, complications can arise, particularly in individuals with weakened immune systems. Potential complications of herpes include recurrent outbreaks. While antiviral medications can suppress outbreaks, some people experience frequent recurrences. Neonatal herpes. This serious condition can occur when a baby is exposed to the herpes virus during childbirth. It can cause serious health problems for the newborn. Meningitis. In rare cases, herpes can lead to inflammation of the membranes surrounding the brain and spinal cord. It's crucial to discuss any concerns about potential complications with your healthcare provider. Section 9. The psychological impact of herpes. Receiving a herpes diagnosis can be emotionally challenging. The stigma associated with sexually transmitted infections can lead to feelings of shame, guilt, and anxiety. It's essential to remember that herpes is a common infection and doesn't define you. Coping with the psychological impact of herpes often involves seeking support. Talk to a trusted friend, family member, or therapist about your feelings. Educating yourself. Understanding the virus and how it's managed can help alleviate anxiety. Joining support groups. Connecting with others who have herpes can provide a sense of community and reduce isolation. Remember, you're not alone, and there are resources available to help you navigate the emotional aspects of herpes. Section 10. Breaking the stigma. Herpes education and awareness. Stigma thrives in silence. By increasing education and awareness about herpes, we can break down the myths and misconceptions surrounding the virus. Open and honest conversations about sexual health are crucial. Encourage accurate information sharing about herpes transmission, symptoms, and prevention strategies. Challenge stereotypes and promote empathy for those living with the virus. By fostering a culture of understanding and support, we can create a more inclusive environment for individuals with herpes. Section 11. Your journey to herpes management. Living with herpes is a personal journey that requires open communication with your healthcare provider, self-care, and a positive mindset. Remember that herpes is a manageable condition, and you have the power to live a full and healthy life. Prioritize your well-being by following your doctor's recommendations. Take your medications as prescribed and attend follow-up appointments. Managing stress. Engage in stress-reducing activities like exercise, meditation, or spending time in nature. Practicing good hygiene. Wash your hands frequently and avoid touching your face or genitals unnecessarily. By taking an active role in your health and well-being, you can navigate the challenges of herpes with resilience and optimism.